National Immunization Awareness Month, and the American Association of Immunologists wants you to know that it's critical for everyone to get routine vaccines. And joining us now is Dr. Avery August to talk about the importance of vaccines. Good morning, doctor. And my first question to you is, vaccines have been used to tame some really nasty and potentially deadly diseases. But let's just begin with how vaccines work for the laborers.
Good morning, Devin, and thank you for having us. One of the things that we know about vaccines and how they work is that they actually are able to take bits and pieces of the virus or the bacteria that we're trying to immunize against and use it to train your immune system against that particular virus or bacteria, so that if, unfortunately, you do get exposed to it, you're prepared and your immune system is ready to prevent against the symptoms that might come from that infection.
So one of the concerns that I feel like has grown in recent years and decades is about vaccines' overall safety. Would you want to speak to that as well?
Yes, this is a concern that immunologists have, that the public has a concern about that. Vaccines are safe. They undergo rigorous clinical studies to ensure that their safety profile is okay, that they prevent the symptoms of the disease, and that they actually work to reduce the symptoms and the debilitating effects of diseases. So by the time they get out to the public, vaccines have undergone many studies with a large number of individuals and are built on many years of research in immunology, in vaccinology, and in safety. So vaccines are safe. They don't cause the disease. They actually prevent disease.
And a quick follow-up. I wonder sometimes if we're not a victim of our own success as people lose contact with some of these really bad diseases that have either been tamed or almost eradicated by vaccines.
Yes, when we see these diseases no longer around us, we think that they no longer exist. But what we see as vaccine rates go down is that they start to reemerge because protection is less. So which is why we really want, as immunologists and the American Association of Immunologists, for us to get back to regular immunization schedules so we can prevent those reemergence of infections.
All right, Dr. Avery August, thank you so much for your time this morning. An important message. Thank you.